This Monday morning, we're helping you be healthy, wealthy, and wise. February is National Heart Month. We're joined by Dr. Brij Maini with the Interventional Cardiologist Department on staff at the Delray Medical Center. First, Dr. Maini, what are some of the biggest issues we see with people who have heart disease?
Good morning, Chris. Thank you for having me here, first of all. The symptoms and signs, what I tell people is, first of all, is attitude. How are you feeling? When you woke up in the morning, do you feel well or not? That's very important. How's your exercise tolerance? If you were used to walking a mile a day, are you walking half a mile now? Is that causing fatigue to you? Are you having any swelling in your ankles? Shortness of breath, lack of appetite, abdominal swelling, things that we may take for granted from time to time are things that may be related to your heart.
What are some of the immediate symptoms, though, that you should look out for, that there might be something wrong and maybe you should go to a doctor immediately?
So chest pains, obviously, that's a proverbial symptom of a heartache, but it may not be chest pain. It could be something as simple as jaw pain. It could be neck pain. It could be arm pain.
Wow.
So anything which you think is not the norm, always call your physician to find out, am I doing well or not? And importantly, it's how old are you? What risk factors do you have? Are you a diabetic or not? Are you a smoker or not? Do you have premature family history of coronary disease? It's extremely important. And I always tell people, you are your father's son. And unfortunately, genetics plays a big role.
Chip off the old block, huh?
Yes.
Well, Dr. Maini, you were telling me that the game's changing and there are some new therapies available in terms of keeping your heart healthy?
It's indeed, and not only therapies, the way we are looking at heart health these days. As you know, the commonest diagnoses for heart patients is congestive heart failure, CHF and those things. And in the days gone by, all we could do was treat them with medicines like Lasix, make them diurese, i.e. go to the bathroom and get rid of extra fluid. What we can now do is very simplistic procedures which are catheter-based. We can change valves in the heart. We can repair valves in the heart. There's a lot of research that's going. And interestingly, there are many studies which have shown 40% improvement in mortality, 40%, more than 40% decrease in rehospitalizations. So we're not there yet, but there's a lot of new things that are coming out. And I'm pleased to tell you, we are doing a lot of that cutting-edge research at Delray at this point in time.
Outpatient surgery, you save time and money, and obviously also looking out for your health. But what are some of the best ways to avoid heart disease?
Idea is take care of yourself. Listen
it seems common sense.
Listen to your body.
Yeah.
What do you eat? Breakfast, lunch, dinner. What is your usual dietary habit? How much alcohol consumption do you have? How much, if hopefully no smoking, how much secondhand smoke? How much stress do you have in your life? And very importantly, people forget about sleep hygiene. Do you sleep well at night? People don't talk about sleep hygiene. I think it is very important.
Or even something as simple as maybe going out for a walk in the afternoon, getting that fresh air.
Yes. Exercise is always the best thing. That goes without saying.
Okay, well, definitely something to keep in mind, not just this month, but throughout the whole year. Little things that you can do to just make your heart healthy and your life that much better. Dr. Brij Maini, thanks for joining us.
Thank you for having me.
All right.